Hello, welcome. I'm Dr. Paul. So we're going to go over the orientation for the True Health and Weight Loss program. So let's just jump right into this. We do have physical orientations, and we just had one. So if you missed it, that's why I'm creating the video to kind of give you an overview of the program. True Health Center is a medical health center focused on prevention and treatment of modern health diseases. And we go over that in the whole program, but modern health diseases such as obesity, type 2 diabetes, arterial sclerosis, coronary artery disease, stroke, high blood pressure, things like that, infertility. So these are kind of modern health diseases that we didn't see in earlier ages. So I want to talk to you about victory. Victory is simply taking a step in the right direction at the moment. Success is doing it often. But the reason I put this quote in here is because that a lot of times we've become overwhelmed about our health or our weight. We've maybe struggled with it, we've fought with it, and we get to the point where it just seems such a huge issue that we just can't find any way to address it. And I want to tell you, just take a step, just take a baby step. You came to this orientation. It's a baby step. We just take one step at a time. Believe me, it's easier than you think to improve your health and to lose weight. And so I hope through the program you find some comfort in that. So victory isn't you putting the whole program together, you having everything fixed up and having it right. Victory is you take a step in the right direction. So let's move on. So I get a kick out of this. Doctor sees the patient all these years and you haven't listened to a damn thing I said, have you? A lot of doctors feel like this, right? You're trying to help your patients and he's just smoking and drinking away. So anyway, a little humor there. That's our program. It says here, we lose our health slowly and quietly. Months, then years, then decades pass. We are losing our health. We've gotten bigger, become slower, and fallen sicker. We are losing our health. We've let ourselves go. We've not cared for ourselves. We're in debt, and we will pay unless we invest. Now, right now, we must invest. Now, we must care for ourselves. For tomorrows are always tomorrow. They never become today. I'll tell you one of the lines that really touches me in this is we lose our health slowly and quietly. And I can testify that is true. And I can testify that is true for many of the patients that we work with. It happens slowly and quietly. You may not even know it, but you've lost a significant portion. And we're here to help turn that around. The bad news behind all this is that 70 to 80% of Americans are in poor health. 75% of men are overweight or obese. 67% of women are overweight or obese. That's almost 3/4 of our population. It tells us there's a significant cultural issues in our population about food, about diet, about all kinds of things. When we send people to the lab to have blood work done, we find out only 12.2% actually come back healthy out of those labs. Prediabetes and diabetes are epidemic levels, and by the way, they are killers. In case you don't know that, they are killers. Heart disease, the biggest killer of all, affects 48% of us. Obesity is the second leading cause of preventable death. We die younger. It's just the truth. Metabolic syndrome is a kind of collection of disorders such as obesity and high blood pressure and cholesterol issues, and that is surely a pathway to early death. When we look about what early death looks like or what we see when poor health happens, these are signs of significant signs of poor health. We can see there's heart disease, high blood pressure, Reproductive disorders. Infertility is really high in the younger population. Liver disease, fatty liver syndrome, cirrhosis of the liver, hypertension, high blood pressure, type 2 diabetes or prediabetes, dyslipidemia or cholesterol issues, obesity. When we have a group of these together, they're often called metabolic syndrome. And that just ends your life about 15 years earlier than it needs to be. So this is kind of the bad news. This is where a lot of us are at. This is where I find people moving into their 40s, their 50s, and their 60s. Well, by the time they're in their late 50s and 60s, they have progressed quite extensively into this, significantly sick. Heart disease is the number one killer. The American Heart Association says 99% of us need to improve our heart health. But it says the vast majority of us are not doing anything about it. You know, the biggest obstacle there is for regaining our health, it's us. It's me. I'm the biggest obstacle for regaining my health. It's you. We're the ones that actually stand in the way often of improving our health or losing weight. We're the ones. So we're the big obstacles. And so I think that it's good for us to understand that, because we're really, really horrible about caring for ourselves. We don't care for ourselves. We invest in other things, but we won't invest in ourselves. Most of us will take better care of our cars or our animals than we will take care of ourselves. It's really true. You see people take care of all kinds of stuff, buy all kinds of things, but they won't invest any money, any time or effort in their own personal health. So it's not just you or me. It's a lot of us. The vast majority of us are just really bad at caring for ourselves. Jordan Peterson, a great psychologist I tend to follow, he says in one of his famous books, The 12 Rules for Living, he says in rule number 2, treat yourself like you're someone you're responsible for helping. And his point there is, if someone gave a person to you or me, and they said, hey, you're responsible to care for them, I bet we would do a really good job. And I bet we'd do a better job taking care of them than we would ourselves. We didn't get into bad health and obesity without not caring for ourselves. You know, I have this little line, you're made in God's image. Whether you believe in God or not, there's a point to be made in this. You're valuable. I'm valuable. There's a value. You've been given a gift. And we have a responsibility, a mandate, a moral imperative to care for ourselves. Just like if you were given something of great value, like your child, you would take care of your child. Or maybe you were given an heirloom or some type of antique from your grandmother or grandfather. You value it. You take care of it. And so in that way, you're valuable. You have a responsibility to take care of your health, a responsibility to be good to yourself, a responsibility to improve your place. I can imagine if you were given a sick animal, you'd probably take really, really good care of it. So we're horrible at taking care of ourselves. We're the ones that stand in the way often. You know, there is no one here or there on the internet that is too sick, too heavy, too old, too far gone, who cannot improve their health and weight loss and lose weight. There's no one. Hope is powerful and vulnerable. It is risky to believe, but believe we shall. I understand if you've been through quite a few programs, it's pretty disheartening. You lose weight and then you gain it all back. You have hope only to face the rather harsh disappointment of it not working out. Hope, it is risky business. Whenever any of us have hope, we always run the risk of disappointment and hurt and pain. But hope is also powerful. Hope will drive us in places we would not go without it. It is risky for you to believe. It's risky for you to come into the program. It's risky for you to entertain taking care of yourself. But believe we shall. We shall do it. I always tell everyone who's coming into the program, you should have a profound respect for the endeavor. We see people that are going to climb Mount Everest. That's profound. That I cannot imagine climbing. I couldn't climb it. I'd die, I'm sure. But to take on yourself, to take on your habits, to take on our mindset, to take on our issue of our own health and take on our issue of our weight, that's profound. That's bigger than Mount Everest. At least Mount Everest, I'm fighting the mountain. This one, I'm fighting myself. So we should have a profound respect for what we're going to do. Taking on yourself is no easy task. You need a clear road to it. You need a path. You need a way to get there. It takes a lot of bravery, a lot of guts. It takes faith. It takes some hope in order to take on the issue. Because let's face it, sometimes so many of us have given up and are depressed and we don't have any hope. So we're kind of stuck. To venture into a program like this is to venture back into going after it again, trying it again. So I respect you for doing it, and I respect the process of doing it, because the hardest person I've ever worked with is me, if you get what I mean. But improving our health is easier than we think. You don't have to figure it all out. We have the steps figured out for you. You just got to take some steps. It's easier than you think. It's kind of like when you have that car and it's got trash in it and you haven't changed the oil and it needs to be washed and the windows are dirty and you look at it and it's kind of burdensome, to deal with it. And you're kind of like, I probably need to get rid of that car. And there just seems so much stuff that's wrong with it. I need to do it. And then one day, maybe you get up and you wash it and you clean the windows and you go get the oil changed and you come home that day and you go, that's a pretty good car. Improving our own personal lot isn't really as hard as one thinks. But when you're in the hole, when you're depressed, when you can't see your way out, it seems really big. So here, you don't have to figure all that out. Just make a step. Yes, next one, you're going to engage your life. You're going to take yourself on. Yeah, that is what we're doing. We're taking ourselves on. We're going to move forward. We're going to learn how to have victory. Yes, that's what it's about. The goal of this program is long-term changes in your perspective and your behavior, right? I didn't get here by accident. It came by my long-term behaviors and my perspective. And you didn't get here by accident either. And the goal of the program is actually to have long-term changes. I don't want to lose weight for 16 weeks and gain it back. I don't want to go through some program where I've learned nothing. No. I want to know how this occurs, how to get out of it. I want to know the science. I want to know the medicine. I want to know exactly how to do it because I want to do it permanently. I don't want to just go through a weight loss program and gain it all back. I'm done with that. So that's the idea of the program. If someone wishes for good health, one must first ask oneself, is he ready to do away with the reasons for his illness? Only then is it possible to help him. And the father of medicine said that. So there's truth in that, right? Am I ready to get rid of the reasons for illness? That's why I said, to take yourself on, that's bigger than Mount Everest. What does the program actually cover? So it covers health testing and assessment. That's about $500. I'm going to go over the health testing. It's quite profound. It has three, I think, of the gold standards in testing. Cardiopulmonary testing, that's a gold standard we have the equipment for that. Body composition, that's a gold standard. We have the 3D body scanner for that, so that's the top of the line. Metabolism, we have the top of the line for that one too. And spirometry, which is testing for lung function, we have that also. And that's a common one. So the first thing we do is we need to assess your health. We need to find out where you're at, because I'm a big believer. Let's find out where you're at so we know where to go. If we don't know where we're at, we don't know where to go. So the first thing is we're going to assess you. We're going to find out where your health is. We have tests, then we have reports, and we have assessments. We're going to be able to tell you where your health is at. So that's a big part of the first opening weeks of the program, and the education behind that. And then there's the medical education and understanding about what health is, what modern diseases are, what's the mechanism for that, obesity, nutrition 1 and nutrition 2, the medical therapeutic diet, and the physical activity. This is all part of the core of the program, which we're going to go over. The next part of the program is we continue to take metrics, health metrics and screening, weight, glucose, blood pressure, oxygen levels. And we do have your tests so we know what's going on. And then the next part is we actually train you and take you out to the park, and we actually go through physical activity training and a plan. And the plan matches what your capacity is able to do. Don't have to. When I started, just walking slowly was good. So we start with where you're at. That's the heart of the program. We assess you, find out where you're at, we know where you need to go, and then we teach you and train you. And by the way, once you go through the program, you'll know more than 99% of the people out there about obesity, poor health, how it happens, and how it can be treated and undone. So that is so awesome. I can't even tell you how awesome that is. That's great. I love that. And you're going to be stuck with me for 16 weeks on that. Okay. Focus. The focus is to improve your health. And weight loss is part of that. The truth is that being healthy is a much more complex question than often people think. If people are skinny, does that make them healthy? No. If people don't have any diagnoses from the doctors, does that make them healthy? No. If people go and get lab work done and it comes back all clean, does that mean they're healthy? No. So you're going to understand what real health is, and our goal is to improve your health. In fact, for some of you, we need to help you rehab your health. So we're going to rehab those who are in really bad condition. Rehab. You got to gain your health back. Not just improve it, you got to gain it back because so much of it's gone. It's a 16-week program led by Dr. Paul. That's me, of course. Extensive training, assessment. We went over that. Also, the program includes attending all programs for that year, for a year. You can come to any of them for free. Again, you can retake the whole program. It doesn't cost you anything. I'm a big believer, and the truth is the next one says Dr. Paul will request follow-up visits for the up to a year at no cost. I will be following up on you for the year because your success is my success. So, yep. And like I said, the real goal is long-term behavioral changes, permanent changes, long-term changes. And nobody gets everything down in 16 weeks. That's our beginning. So you can plan on you'll hang in with us for a year. Okay, let's move on. So the extensive health testing, I had mentioned early. Let me just quickly go over that. There's 4 tests. 3 are the gold standard tests. And by gold standard, that's not my words. That's the medical establishment they use for the best testing in that category. So 3D body composition scan has clearly become one of the best tests for body composition, and we'll look at that in a minute. Resting metabolic rate is the gold standard for testing people's metabolism to see how fast or slow or average that it runs, what your body's actually burning in a 24-hour period. That gives us a lot of information about your metabolism. The next one is the big one, cardiorespiratory exercise VO2 test. That's a huge one. I can't even begin to tell you the ramifications of that. That test is the gold standard of measuring health and sickness or disease. So we'll talk about that in a little while. And then we also do physical training, aerobic and anaerobic, basic training to show you what we need you to do, what you need to do, according to your capacity again. So we're not looking for athletes here, unless you are an athlete. So this is Staiku. Let's see if we can watch a little video on that real quick. We're going to go here. We go there.
Staiku, a new way to measure yourself.
As you can see, this is a 3D body scanner.
Revolutionizing the way we track fitness. Simply stand on a rotating platform while a harmless infrared sensor captures your body's shape and composition. In a matter of seconds, Staiku accurately recreates your body in 3D, revealing detailed information about your body's measurements. Compare and contrast your 3D model and clearly see where you've lost inches throughout your body and throughout your fitness journey. Since fat takes up more volume than muscle, your body shrinks as you shred fat. A digital tape precisely measures changes in your circumferences, like your waist, chest, hip, and more. Overlay your body in 3D to track even the smallest changes in your shape. You're more than a number on a scale. You're more than just one dimension. You're multi-dimensional. Staiku. Reach your potential.
So the first thing we're doing is the 3D body scan, and I can show you. I got some pictures of myself, so hang on. All right, so this was me about 1.5 years ago, and you can see a 46.7 waist. It measures everything, by the way, the Staiku. This is just one little chart of many of them. But you can clearly see me here, and then you can see me here, and you can see the difference in it and the weight. So that was 46.7, this is 41.9. So this is what we use for body composition and risk assessment of that body composition. Another picture, again, you can see the difference here. I look quite a bit different in these. I needed the program, and I still need the program, so I'm excited by it. It charts over here the measurement difference with trends. Then we look at the next one, again, same kind of deal. So you could just see the vast difference there in that. So that's the 3D body scanner. That's included in the program. The next one is rest and metabolic rate, and I'm just going to give you a quick video of that, a quick shot. And a lot of it's talking, so I just want to.
Your diet isn't working. You don't understand.
Kind of want to
Weight while others stay the same or lose weight. So what do? Start your diet from the inside out with a resting metabolic rate test. Sit back, relax, and discover your body's unique caloric needs. Then, as you apply the results to your current diet, or plug them into the Metabolic Meal Plans app, you will finally see your dieting efforts turn into lasting success. Find success in dieting by eating to your metabolism. Get your resting metabolic rate tested today. A message from Core Medical Technologies.
So Core is the medical company we bought our equipment from, so that's why I'm using their videos. So going back, so the rest metabolic test is actually measuring your metabolism and how fast it burns. It is the gold standard of what every nutritionist would hope to use with their own clients. So that's included in the program. The next one's the big one, cardiovascular testing, or VO2 max. It is the gold standard. It is used primarily in medical research universities, Olympic athletes, and teams, cardiologists, and physiologists. It's the gold standard because it has become the probably the only way, how do I say it? It's the gold standard of measuring health. And that is a big deal. So let's see if we can just show you a little piece of it. So I'm going to turn that sound off. So this is a gas analyzer. They are quite expensive and they're delicate pieces of instrumentation. He's wearing a mask because everything that he breathes in and out is being measured. His oxygen utilization, his carbon dioxide production, this is all being measured. His heart rate is being measured. This test actually measures health. It is actually one of the most important tests I think that anyone could ever take. I really, really love this test. I believe so much in it. And I'll show you why. I'm going to go ahead and stop that. A lot of the testing is walking on a treadmill, and if you can't walk on the treadmill, then we'll put you on a bike. So we have both ways. I'm going to stop it there. Go back to our point here. The American Heart Association in 2016 had sent out a letter to all of the providers across America recommending that all the providers start using VO2 testing in their patients' health. And this is what they said in that document, that VO2 testing was the most important overall correlate of health. That is huge. What they're really saying there is the best test that we have for health is VO2. Profound. 2016, they want all their providers to start using it. It is the strongest predictor, strongest. And if you understand medical history, you know, they're always looking for ways to assess and evaluate people on their health. But it turns out VO2, the strongest predictor of cardiovascular disease and all-cause mortality. Yeah, that's why I'm involved in it. And then they recommend all adults should have their coronary or their cardiorespiratory fitness, VO2 max, measured on a regular basis, similar to other preventative services. I can't tell you how big an issue this is. It's awesome. So, but it's part of your test. We also do field testing. We go over here to Mariposa Park and we do testing for aerobic and anaerobic, because the key is to get us healthy again, not just to lose weight, but to get healthy. And this type of exercising isn't as difficult as you might think. In fact, most of our groups, we get it accomplished just by adjusting our walking speeds. So, yeah. We're also going to look at the science of VO2, but we look at your heart rate and we look at your O2 utilization at the park there. So we train you according to that. All right. So that's part of it. Nutritional education. We'll just name a few things here. So we're going to go over the history of dietary changes over the last 100 years. It's crazy. You won't believe it. The history of poor health and obesity and how it came about. The mechanism of weight gain and weight loss. Both the science and the history. The latest in nutritional science, which is really awesome. I'm so excited by that. The science of poor health and obesity. The science of health and weight loss. The science of non-activity on health. There's a wonderful study on that. 167 pages. We're going to highlight some of the big ones in there. Health risks on obesity and poor cardiorespiratory fitness. How small changes have huge impacts. Oh, that's a very interesting one. About deciding your future, where you could go. Hope again, right? Hope. And an exercise plan designed by your health status, according to your health status. So, yeah. What's the cost? Right now, this is February 2021, and the registration is $150. At the orientation, it was $125, but the registration is $150, and a weekly payment of $50 a week for 16 weeks. So if you go through all of that and you pay, you find out you have a total investment into yourself of $950. Not bad. I don't think so. That's for 4 months, by the way, 16 weeks. So a little over $200 a month. And there is no program like this, I can tell you right now. There's nobody doing this. This is not your regular weight loss program. This is a medical health and weight loss program. So just to give you an idea about investing in yourself, which I think you're worth it. Remember, 16 weeks, $950. Our cars averagely cost us about $8,000 a year. Eating out another $3,000. Our housing's about $9,500. A total of $21,000 a year. And this is true. We see this all the time. I'll see a big husky guy, and he buys a big Ford truck, 250, that runs about $45,000, and got to throw some insurance on that and some gas, and you have a truck payment there of at least $500 a month. And then maybe he's got a toy and a quad, or who else? Maybe a boat, something else. It's true that we will spend hundreds, maybe even up to thousands, on these kind of things, but we won't invest a couple $100 into our health. And without our health, all the rest of it means nothing. So you should never feel bad about making an investment in your health. You won't ever do this program and then later on go, man, I really wish I didn't spend that $950. You'll never do that. You'll be like, I'm glad I did it. You know, when you learn something and you have an education and your eyes are open and you see a new way and a new path and a way for yourself, that's priceless. That's what that is. I feel like the program is priceless, been priceless for me. Let's see. What was I going to say? Oh, so one of the things that, you know, it is difficult out there to know between scammers and people who are just interested in money. We're not like that. Our clinic has always been a clinic, our acupuncture clinic and our medical health clinic has always been a clinic that's, we serve people first. That's our first goal. It's always been mine. It's the way with all the other doctors that are here. Our first thing is to take care of our patients and let the finances take care of themselves. We don't worry about it. So we came up with some financial approaches in case it seems a little too expensive for you. The registration obviously was for the orientation of $125. It's $150 now and $50 a week. But we can always do the registration and then extend your payments over a longer period than 16 weeks. We can make it so it's not as hard on you, you know, or hard on anyone that needs help. We also can just finance the whole thing. You can start it and then we'll just put in the registration and the program all together and finance that over a period of time. Something that works for you. We're not hooked up on the money. If we'll do whatever we can to help you make it and get there. So just so you know that. Okay, great question. When do we start? Well, this will date this video, but we start February 23rd, within a few weeks. And we meet at 6:30 every Tuesday night for 16 weeks. So I want to encourage you, if you want to be a part of it, call to register. Call now. There's the phone number. They'll help you get registered. Or you're welcome to call and have a free consult with me. I'd be glad to help, answer any questions I could. It's a glorious program. I look forward to meeting you. Thank you for spending the time to watch it. Like I said, if I can be of any service, feel free to get a hold of me. I'm here to help. In fact, everyone at our clinic, we have a great staff. They're here to help you. We have great doctors. So, again, thank you for watching. See you there.